So I got distracted with a patient that walked in. So this is part two of dealing with constipation, and I ended up with posture. And I wanted to go over, some basic things with posture because it's such a problem in our society today. I want to encourage you to do posture exercises for your core training, for your core muscles, because those are the ones that get weak, can cause a whole series of problems. The weakness here in the abdomen, if you can't control that exercise where you suck in your belly and go in and out and go, that's what I do. You breathe in and out like that so that the stomach goes in and out like that. That helps to move the colon and allow the motility to happen, the movement of the bowels to go through the bowels, of the bowel movement to go through the bowels, and loosen up and open up the bowel itself. So core training is going to be key to that, and practicing, learning to practice. You may need to get in different positions in order to get be able to do it, because if you cannot do it, there can be several things. Like I said, a big belly can do that, weak muscles can do that. Surgeries from episiotomies can weaken those abdominal muscles, and so that's a tough one. You may be able to clear out those surgery sites by using what we call mud packs or essential oils. We have an essential oil blend here that gets rid of some of the miscommunication or misfiring of the meridian that's going through that area. But you have to really work on it, because when nerves get cut, they get cut, and it takes time for them to grow back. But then you develop a chronic weakness, and it just takes a lot of work to be able to get that back. And so look up core strengthening exercises on the internet. So that's about movement of the abdomen. The last part is movement of the legs. So a lot of the meridians that go up and down the body, some of them go head to toe. Let's see, this one here, the central meridian goes through this way. So I've seen chronic constipation because of a scar from surgery here. I've seen, that was my most dramatic one, where it was a 2-year-old boy, would not go to the bathroom for for 2 weeks, and so the boy was throwing up the food, and the mom was at her wit's end. I treated the scar here, the constipation left. So that's an unusual cause, but it's on the same circuitry, and if you look meridians online, that circuit goes here. But other head to toe meridians would be actually the bladder meridian, which is in the back. It goes from head to toe on the back. The side meridians here, called the gallbladder meridian, goes up from the side of the foot all the way up to the head. So that's head to toe. And many of them run up and down the body. And so if you cut any of those communication pathways, now you get misfiring or short circuits. You want to be able to keep the circuits flowing, and scars prevent that from happening. So you got to investigate those scars, injections, old injuries, fractures, head injuries. I see a lot of people here with short circuits in the head, and I've treated several people that felt euphoria after I dealt with the pressure points in the head. They're just signs of basically inflammation points on the head, and that presses on the brain underneath, and now you're getting brain fog, you're getting inflammation, headaches, and miscommunication in the rest of the body, because the brain signals are stopped from short circuits in the head itself. So I would treat their head, take off the pressure. They feel light, they feel sometimes euphoria. One person had great intimacy with their partner that night. I mean, it affects a lot of different things, and so you want to I treat the head a lot, and short circuits in the head quite a bit. So those are the meridians and pathways and scars and all that about the abdomen. You want to loosen it up. The legs have a lot of those meridians, and when you're moving the meridians, like walking, in this case you're sitting, and I just raise my knees up and down like this when I'm on the toilet, and that can stimulate the meridians in the colon. And so in all, you can do this one at a time, and then when you're good at it, then you can start doing combination. You go like this, back and forth. This, back and forth. And I'm raising my knee up right here on the right like this. Right, I'm raising my left knee here. Right knee, left knee. and I'm stretching my shoulder at the same time. And then if that doesn't work, I do those abdominal things. And the last thing you do with the abdomen that I forgot to tell you is you can actually stimulate the colon points. If you take the pelvis, which is the top bone here of your hip or pelvis, it's the high point, and you go 2 inches in, you'll see those reflexes there are the colon reflexes. They're very common in chiropractic circles, or if they do alternative testing, is to stimulate that point, and it's called the ileocecal valve. There's an actual valve there. And there's a valve on this side that transitions from the small intestine here from the small intestine to the large intestine, and here from the large intestine to the rectum. And those valves can get shut or open, open, and they shouldn't be shut or open. They should be a valve that shuts and opens automatically with the passing of bowel movements, right? So, but some of them stay open or stay closed and can cause diarrhea, constipation, etc. So you massage those points just basically in circles, and you can do that while you're breathing in and out, and bringing that, doing those belly button in and out exercises where you breathe in and out like that while you're stimulating that, and see if that helps. So that's what I've found to help most of my patients, and they're tested and tried, and they work. And so let me know what your experience is. You can always contact me at 714-528-2219, or comment on this Google, on this video, or comment on my blog on drquick.com, and let me know how it works, because this struggle is a big problem for many people, and we haven't even talked about diet. So that probably should be our next talk. I'll talk to you next time. I'm Dr. Paul with Body Intelligence Center. God bless you.